Assalamualaikum viewers and welcome back to our channel Denver's Hub. Today in the playlist of oral and maxillofacial surgery, we will be continuing on the same Impaction series. In that regard, our today's video will be about the classification of the impacted mandibular third molar. So first of all, the first classification system is of the Winter's classification that was based on the angulation of the third molar. And based on the position of the long axis of the impacted third molar tooth in relation to the long axis of the second molar tooth, he usually calculated out the angulation. So we have listed some important angulation of the impaction in the order of increasing difficulty. So first of all, the mesioangular case that has a common occurrence of 43%, the most common one to occur, and the angulation ranges from the 10 degree to 80 degree. It is most easy but most damaging impaction to be performed during its removal. Secondly, we have more difficult from the mesioangular one is the horizontal one. That has the occurrence of 3% and the angulation of 350 degree to the 10 degree. In the horizontal, you need to remember that the crown it is mesial and the root it is distal in the anterior-posterior plane. Now from the horizontal, most difficult one is the vertical one. That has the occurrence of 38% and the angulation of 80 to 100 degree. And from the vertical, the difficult one is distoangular, and distoangular it is most difficult of all. It has the occurrence of 6% and the angulation is greater than 100 degree. We can also have the other types of impaction as well. That is the buccoangular towards the buccal aspect, linguoangular towards the lingual aspect, inverted. In that case, the crown is totally inverted, and the transverse one, in that case, it is different from the horizontal one. That crown is usually lingual and the root is usually buccal. While the horizontal, we were discussing the angulation in the anterior-posterior plane, that is in the mesiodistal plane. We have another classification system as well, that is the Pels and Gregory classification. So Pell and Gregory, it classified the impaction based on the relation to the anterior border of the rami, the relation to the occlusal plane. First of all, we will be discussing the classification in relation to the anterior border of the rami. So first of all, the category class 1 include if the mesiodistal dimensions of the crown it is completely anterior to the anterior border of the ramus. It will be termed as the class 1 impaction. In the class 2 impaction, the half of the mesiodistal dimension it is interior to the anterior border of the ramus, and in the class 3 impaction, the mesiodistal dimension it is completely posterior to that of the anterior border of the ramus. Now we will be studying the classification in relation to the occlusal plane. So first of all, the position A, it is when the occlusal surface of the impacted tooth it is in level with the second molar. It will be termed as position A impaction. The position B impaction, it is when the occlusal surface of the impacted tooth it is between the occlusal plane and the cervical line of the second molar. And the position C is when the occlusal surface of the impacted tooth it is below the cervical line of the second molar. So in the first case, that was the position A, it was at the level of the occlusal plane of second molar, and in case of the position B, it was present between the occlusal plane and the cervical line of second molar, and in the position C, it was below the cervical line of the second molar. Now we have another classification as well, that is the Thomas classification. In the Thomas classification, he classified the impaction as this one having the straight roots, or the roots that are curved mesially, or the roots that are curved distally. We can also classify the impaction based on the surgical procedure. So it could be a soft tissue impaction, the partial bony impaction, or complete bony impaction. So this was all about the classification of impaction. I hope this video will be helpful for you all. Don't forget to subscribe to my channel and also click on the bell icon so you will get notified about our future videos and updates. Thank you.